You see if your doctor or a provider that's important to you is in the network, but you also would see if your prescription drugs are covered, the plan formulary or the list of covered drugs, and what is the cost. And I know sometimes it's hard for people to think, what am I going to be spending in a year? But a lot of people already know beforehand what their general, because with your help, they can kind of get an idea of what they spend in a year on healthcare costs. And again, the other thing too is, does the plan have a convenient pharmacy? Do they, some plans they do mail, some will just have you go to your local pharmacy, but check the plan to be sure. And check the plan rules. Do you need to have a referral? Like, can the primary care doctor refer you, or do you need a prior authorization or a pre-authorization? That's the permission before you can see a specialist. Or can you go directly to a specialist? Again, these are questions you already know, but in talking to a few of you now on the break, it's just sometimes it's just little things that you think about that, that's something that it will be helpful to remember when I'm talking to one of my clients. For example, once they go through, they apply, or maybe they apply on their own, they get the plan information in the mail, and they set up an appointment to come see you because they get a packet of information, and they're like, what is all this? What do all these terms mean? And that's why it can be very helpful for you in your work to help them with this. Now, the summary of benefits and coverage, which Nikki alluded to before, this is actually something that's mandated by the Affordable Care Act. These all look the same. It's not the explanation of benefits. How many of you know what the explanation of benefits is? Okay, when you have a service, you get a statement after that shows what was the service, what was covered, what wasn't. Okay, this is different. All right, this is actually, it's on our website, the summary of benefits and coverage. It should be on the provider's website. This, again, health insurance companies and group health plans are required to provide consumers with an easy-to-understand summary of the health plan's benefits and coverage. Again, it's per the ACA mandate. It's accompanied by a glossary of terms, such as the terms we have in our module as well. And the summary of benefit and coverage also allows the consumers to compare plans and understand what each health plan offers. It includes details, coverage examples,